Prostate cancer is a type of cancer that occurs in the prostate gland, which is a part of the male reproductive system. Some individuals, when diagnosed with prostate cancer, opt for a strategy called active surveillance, which means they don't immediately treat the cancer. This is because prostate cancer often grows slowly and doesn't usually leave the gland. However, if the cancer is aggressive and likely to spread quickly, there are two common treatments: radiation therapy and surgery. These treatments aim to remove or destroy the cancerous cells. Firstly, let us get the basic idea of what is prostate cancer. Prostate cancer is a type of cancer that starts in the prostate, a small gland in men and people assigned male at birth. This gland is like a tiny walnut and sits below the bladder and in front of the rectum. It makes a fluid that mixes with sperm to help them stay healthy for making babies. Prostate cancer is a serious illness, but the good news is that most people with it are found early before it spreads outside the prostate. When it's caught early, treatment often gets rid of the cancer. Now, what are the types of prostate cancer? When you're told you have prostate cancer, it's usually a type called adenocarcinoma. These cancers begin in the cells of glands, like the ones found in your prostate, which produce fluid. Prostate cancer can sometimes originate from other types of cells, but this is rare. There are also less common types of prostate cancers, such as small cell carcinomas, transitional cell carcinomas, neuroendocrine tumors, sarcomas. These kinds of prostate cancers are not as frequently seen as adenocarcinoma. Okay, now that we have precisely understood what is prostate cancer, let's dive into the 8 symptoms of prostate cancer. Remember, this video is for educational purposes only and not as a medium to replace your doctors. 1. Frequent, sometimes urgent, need to pee, especially at night. As prostate cancer develops, it can cause the prostate gland to grow bigger and press against the urethra. The urethra is a tube that carries urine from the bladder out of the body. When the prostate squeezes on the urethra, it can make it harder for urine to flow properly, leading to the symptoms mentioned. Frequent need to pee because the urethra is squeezed. The bladder might not empty completely each time you urinate, so you'll feel like you need to go again sooner. Urgent need to pee. The pressure on the urethra can cause a sudden urge to urinate because the bladder can't hold as much urine. Nighttime urination. This pressure can also affect your ability to sleep through the night without needing to urinate. You might wake up multiple times to go. It's important to remember that these symptoms can also be caused by other non-cancerous prostate conditions, like an enlarged prostate, benign prostatic hyperplasia, or BPH. Not everyone with these symptoms has prostate cancer. However, if you're experiencing these symptoms, especially if you're over 50 or have a family history of prostate cancer, it's essential to see a doctor. They can perform tests to determine the cause and recommend appropriate treatment. Early detection can be crucial for better outcomes. 2. Weak urine flow or flow that starts and stops. Prostate cancer can cause changes in the prostate gland, like the growth of abnormal cells. As these changes happen, they can affect how the prostate functions, which can lead to these urinary symptoms. Weak urine flow. The prostate surrounds the urethra, which is the tube that carries urine from the bladder out of the body. When the prostate gets larger due to cancer, it can squeeze the urethra, making it harder for urine to flow freely. This can result in a weaker urine stream flow that starts and stops. The pressure from an enlarged prostate caused by cancer can disrupt the normal flow of urine. It might feel like you're having trouble getting the urine to come out, or that it starts and stops during urination. 3. Pain or burning when you pee. Prostate problems, such as prostate infections or inflammation prostatitis, can sometimes lead to urinary symptoms, including pain or burning when you pee. Here's how prostate infections or inflammation. The prostate gland can become infected or inflamed, which can cause discomfort or pain in the lower abdominal area. This discomfort may also be felt during urination, resulting in a burning sensation. It's important to note that while prostate cancer can cause urinary symptoms like weak urine flow or frequent urination, as mentioned earlier, it is less likely to cause a burning sensation during urination. A burning feeling is more commonly associated with UTIs or other urinary tract issues. If you experience pain or burning when you pee, it's essential to seek medical attention promptly. A healthcare provider can diagnose the cause of your symptoms and recommend appropriate treatment. UTI is typically treated with antibiotics, while prostate-related issues may require different types of medications or therapies. Timely medical evaluation can help manage any underlying conditions effectively. Number 4. Loss of bladder control, urinary incontinence. Normally, you have control over when and where you urinate. However, if you experience urinary incontinence, it means you can't always control when urine leaks from your bladder. This can result in unintentional wetting of your underwear or clothing. Now, let's discuss how urinary incontinence can relate to prostate issues, including prostate cancer, prostate conditions, and urinary incontinence. Prostate problems, such as an enlarged prostate or prostate cancer, can affect the urinary system. When the prostate gland enlarges, it can press against the urethra, the tube that carries urine from the bladder. This pressure can interfere with the normal control you have over urination, leading to urinary incontinence. Number 5. Prostate issues and erectile dysfunction. The prostate gland is located near the base of the penis and is involved in the production of substances that help with ejaculation. Prostate problems, such as prostate cancer, can sometimes affect the blood flow, nerves, or hormones required for a healthy erection. Additionally, treatments for prostate cancer, like surgery or radiation therapy, can also impact erectile function. It's important to note that while prostate issues can contribute to erectile dysfunction, there are various other potential causes for this condition, including stress, anxiety, cardiovascular problems, or medication side effects. Number 6. Loss of bowel control or fecal incontinence. Experiencing a loss of bowel control, known as fecal incontinence, can be distressing and uncomfortable. Here's a straightforward explanation of this symptom. Normally, you have control over when and where you have bowel movements. However, if you have fecal incontinence, it means you can't always control when you have a bowel movement, leading to unintended or accidental bowel movements. Now, let's discuss how fecal incontinence can be related to prostate issues, including prostate cancer. While fecal incontinence is not a common symptom of prostate cancer itself, treatments for prostate cancer, such as surgery or radiation therapy, can sometimes affect the muscles and nerves around the prostate and rectum. These treatments can weaken the muscles responsible for controlling bowel movements, potentially leading to fecal incontinence as a side effect. Number 7. Blood in semen or hematospermia. Noticing blood in semen, which is hematospermia, or urine, can be a concerning symptom. Let's explain it simply. Normally, semen is a white or yellowish fluid that carries sperm. If you see blood in your semen, it means there's red blood mixed with your semen. This can be alarming. Urine is usually clear or pale yellow. If you see blood in your urine, it means it's pink, red, or brown in color, which is not normal. Now, let's discuss how these symptoms can be related to prostate issues, including prostate cancer. Blood in semen can be associated with prostate problems, like prostate infections or inflammation. In some cases, prostate cancer may also lead to this symptom. Although it's less common, blood in urine can also be related to prostate conditions, including prostate cancer, particularly if the cancer has spread to nearby tissues. Number 8. Pain in your low back, hip or chest. This means you feel discomfort or an ache in the area of your back, just above your buttocks. It's often called the lower back or lumbar region. Pain in your hip. Hip pain refers to discomfort in the area where your thigh bone connects to your pelvis. It can be felt on the side of your body or in the buttock region. Pain in your chest. Chest pain is a sensation of discomfort or pain in the front part of your upper body, usually around your breastbone or rib cage. These types of pain can result from various causes, including muscle strains, herniated discs, arthritis, or issues related to the hip joint itself. Now that we have gone about the symptoms, let's look at how we can prevent these symptoms in the first place. Firstly, let us look at the things you cannot change, like age, race, and genes. Prostate cancer is most commonly found in older individuals. As you grow older, your likelihood of developing prostate cancer increases. Additionally, your racial background and genetic makeup can also influence your risk. African American men have twice the risk of developing prostate cancer compared to white American men. If you have a family history of prostate cancer with your father, brother, or several close blood relatives having had it, your risk is also elevated. While it may be challenging to prevent prostate cancer, when these risk factors are present, early and regular screening can be essential. This helps ensure that if you do develop cancer, it can be detected and treated promptly. Now, let us look at things you can change, like diet and lifestyle. Prostate cancer rates are notably higher in Western countries compared to Asia. And while there isn't a definitive explanation for this, experts believe dietary differences between the two regions might be a contributing factor. Unhealthy eating habits, particularly diets high in fats and animal proteins, can lead to DNA damage and an increased risk of cancer. Even for men with existing risk factors such as age, race, or genetics, adopting healthier lifestyles and diets can reduce the chances of developing prostate cancer. Improve your diet. Although the exact link between diet and prostate cancer prevention isn't fully understood, research suggests that certain dietary habits may be beneficial. Reduce fat intake. Cut down on trans fats and saturated fats, and prioritize healthy fats like omega-3 fatty acids found in nuts, seeds, and fish. Increase fruits and vegetables. Incorporate a variety of fruits and vegetables, including leafy greens. Lycopene, an antioxidant abundant in cooked or processed tomatoes, has shown potential in slowing prostate cancer cell growth. Cruciferous vegetables, like broccoli and cauliflower, contain sulforaphane, a compound that may offer protection against cancer. Include green tea and soy. Clinical trials have indicated that soy might lower PSA levels, and green tea may help high-risk individuals reduce their prostate cancer risk. Avoid charred meat. Cooking meat at high temperatures, leading to charring, may produce chemicals linked to cancer. Maintain a healthy weight. Obesity is a risk factor for more aggressive prostate cancer. Maintaining a healthy weight as you age can reduce the risk of cancer and various other health problems. Get regular exercise. Exercise not only helps maintain a healthy weight but also reduces inflammation, enhances immune function, and counters the negative effects of a sedentary lifestyle, all of which contribute to cancer prevention. Quit smoking and limit alcohol. Quitting smoking has numerous health benefits, including lowering cancer risk. If you consume alcohol, do so in moderation. Some studies suggest that red wine, due to its antioxidant properties, may have health benefits. Boost your vitamin D intake. Vitamin D deficiency is common, and it can help protect against prostate cancer and other conditions. Foods rich in vitamin D include cod liver oil, wild salmon, and dried shiitake mushrooms. Sun exposure without sunscreen for 10 minutes daily is also recommended, but vitamin D supplements may be necessary. Consult your doctor before taking any supplements. stay sexually active. Some studies suggest that men who ejaculate more frequently, either with or without a partner, have a lower risk of prostate cancer. Although ongoing research is needed, some experts believe that ejaculation helps eliminate toxins and substances that could lead to inflammation. Consider prostate cancer prevention drugs. Men with benign prostatic hyperplasia may be prescribed dihydrotestosterone DHT lowering drugs like finasteride or dutasteride. These drugs have been studied and could reduce cancer risk by approximately 25%. However, patients who develop cancer while taking these drugs may face a more aggressive form of the disease. Discuss the pros and cons with your doctor.